In the shadows of the Rwenzori Mountains, demand for contraception is rising. Yet for many families in Kasese and Fort Portal, getting the right method at the right time still depends on chance and the last delivery truck. Nationally, modern contraceptive use among women of reproductive age stands at 29.8%, while unmet need is at 18.5%. Progress, yes, but still far from mission accomplished. Behind these figures are personal stories of dreams interrupted and futures delayed by a persistent shortage of family planning commodities and the absence of comprehensive sexuality education. In Uganda, open conversations about sexual health remain taboo. And for a country with one of the youngest populations in the world, the consequences are visible in the growing number of teenage mothers. 17-year-old Rusundo Bira and her 6-month-old baby walked to Kitswamba Health Center 3 for a routine checkup. She once dreamed of becoming a hairdresser, but school fees cut her studies short. That's when she met a man who promised her love and a better life.
I met
the man in the town center. He was a taxi driver at the time. We fell in love over time, and after about 3 months, I told him I use a contraceptive, the injection in particular. He asked me to stop using it. I refused at first, but he insisted. I was 15 years at the time. When I turned 16, I stopped using the contraceptive. He took me to his family, so I believed we were going to get married. But after I told him that I was pregnant, he told me he was not ready to become a father and that he was leaving for Kampala to find a job.
Leaving Bira to face motherhood alone.
I did not tell anyone for the first 3 months of pregnancy. I would spend nights crying, sometimes without food. When I could not take it anymore, I told my mother. She took me back to the man's parents, and his father said they don't know me as his wife. I stopped studying my hairdressing course because I feared that people would laugh at me. Meanwhile, when I contacted the man who got me pregnant, he told me he's going to find another woman because I am now old and have a child, and that he could stand to be seen with me as his wife. At home, my mother said I can no longer go back to school because I am now a mother, so she will now focus on the young ones. For now, I fry donuts and sell them to earn some money to fend for my 6-month-old baby.
Bira's story mirrors the reality of many girls in Kasese district, where 22 out of every 100 teenage girls become pregnant each year, exposing them to health risks and cutting their dreams short.
This teenage pregnancy is due to poverty. It has also been attributed to some violence in the communities.
Young girls, particularly teenagers, actually show up late at facilities for antenatal care because of the shame. They don't want to talk to their families. Some of them don't even know they are pregnant until it's quite late. So when we're looking at teenage pregnancy from the medical records or what is routinely collected at facility and district level, again, the proportion is around 23 to some areas going to 28. But we know that it is possibly greater than that because some of them actually do not even attend the entire antenatal process, and they show up at delivery or emergencies or traditional birth attendants.
Uganda currently allocates about 15.2 billion shillings each year for family planning, still below its earlier pledge of $5 million, roughly 19 billion shillings. Even then, much of that money is spent on other reproductive health items such as delivery kits, leaving little for contraceptive commodities.
Men haven't been involved in the family planning. Even women who are come for family planning services, they sneak away from their men, they come and get the family planning services. After getting them, they go home. When they are realized by their men that they are using family planning services, there is gender-based violence which is coming up. You are still young and you are using family planning methods. That means you are a prostitute. That means you are sleeping with a lot of men. You want to protect yourself from getting pregnant, but you are doing adultery part of it.
They are full of myths and misconceptions. Like family planning brings cervical cancer. Family planning has increased the barrenness in women. Men are not performing well because of family planning. Like when a woman goes for family planning and a man will no longer feel that woman well because she has injected in something.
The staffing levels are really low in that we get big numbers of clients who come to our facility to get family planning services. But all in all, we manage to manage the big numbers, though we can also get like fatigue, a lot of stress, and we are overworked. Burnouts are very common.
The situation worsened after the withdrawal of key support from international donors, including USAID, following policy shifts under the Trump administration. Still, local partnerships remain the backbone of service delivery. Organizations such as Maristops Uganda continue to work with district health teams to extend outreach to keep supplies flowing, even through community networks.
If we can prevent that first child but delay it until they are ready, their bodies are ready, I think then as a country we will have won in this fight against teenage pregnancy. And some of the cultural practices, or even the people that make these young girls pregnant, are even older men. And as Maristops, we have from this year actually started a very specific male engagement service delivery campaign, which is focused on vasectomy services. And we are asking older men, if you already have your ideal family size, can you come and do it for the women and the girls that are there and take a vasectomy?
Even secondary students are being involved in family planning. Most of them come here to our health center and we give them the service. We even make outreaches to them and we talk to them, we counsel them, those who are eligible for it and those who feel like having it, we give them when they are there in schools.
In Kasese and Fort Portal, access to contraception remains a daily struggle shaped by supply chains, social stigma, and funding gaps. Until consistent supplies reach the last mile, Uganda's promise of reproductive choice will remain just that, a promise, not a reality. Walter Mwesije, NTV.